Ask these 4 important questions before you get a root canal.
So you find yourself at the dentist and you're in a lot of pain. But I want you to take a pause for just a moment, because obviously you're in a very stressful situation. You're in pain, you may have been up for a day or two, and this thing is just getting worse. But you need to take the time to pause for a moment and ask some very important questions before you proceed. The questions that I'm going to share with you today are 4 important questions that will build on top of each other. And this will kind of help direct you in the direction that you should go for yourself. And please do take some careful consideration before making any decisions as far as your tooth goes.
Hi, Dr. Delacruz here. So I do perform a lot of different procedures in my office, one of which is a root canal. The first question you should ask is the tooth restorable if you're considering a root canal? In this first picture, what I'm showing you here is basically a cutout of a tooth where the cavity started, and as it works its way into the center of the nerve, that's how you ended up with an infection. But what I want you to pay attention to is that green line that goes across that tooth. That's where the bone would be in relation to that crown. The reason that is important is you want to have enough healthy tooth structure that you can restore that tooth properly, because if you cannot do that, that tooth is not going to survive. In fact, in this next x-ray here, it shows you in red there the outline of the cavity, and as you can tell, it goes much closer to that green line. And if that's the case, you as a patient are not going to be able to clean that properly, and as the dentist who is restoring this tooth, it's going to be very difficult for us to put that together and properly seal that off. So it is very important that you do ask, is this tooth restorable, before you should even consider a root canal. Okay, the second question you should ask is, how complex is this root canal? Okay, one of the more common ones that I want you to look for is what is called a dilacerated root. In this first example, outlined in red, is, to me, it looks like it's kind of dancing. Okay, the more curvatures you have in a root, the more difficult it is for a root canal to be performed. And in the second photo here, I'm just showing you basically the different variations of how these canals and how the nerve can kind of interwoven into the tooth. The more path and canal ways and connection points, the more difficult the root canal is. And so for this kind of important why your endodontist or your dentist should have a cone beam or a CBCT that can kind of give them an idea in 3D perspective how these canals go through the tooth. Before I move on to the third question, if you like this content, please consider subscribing. Now for the third question, what you should ask the dentist is, what is a long-term prognosis for this treatment? And it might be your endodontist that you're asking this question. There are many reasons, but one of the big ones for me is a sclerotic or a calcified canal. In this first example here, I am showing you a root canal that was performed. As you can tell in that yellow right there, it's the gutta percha, but it stops short of what we call the apex. So outlined in red there is the actual root. And if you look at the root next to it there in blue, it shows you that it goes all the way to the apex or the root tip. And in this case, the canal was sclerotic or calcified, and so they couldn't advance the file down further into the tooth, which makes this for a poor prognosis long term, as you can tell in that dark area around the root itself. Now there are other reasons why the prognosis of a tooth would be poor long term, even if you can restore it. One of it is like if the tooth has already had a root canal and needs to be retreated. Another example is if the tooth is fractured, or they get in there and open it up and clean it and they see some cracks going through the tooth. So this, and there are many other ones, but these are the more common ones that I see. So take into consideration the long-term prognosis of the tooth first before you make that decision. Okay, so the final question you should ask is, if the prognosis is poor for this tooth, what is my alternate solutions? Okay, typically it comes down to 4 different types of solutions. The first one is you take the tooth out and you leave it be, but there are some complications that can occur with that. I will go to that into a different video. The second option is a partial denture. So in this picture here, what I'm showing you is basically fake teeth with metal there that hooks around your natural tooth, and it can replace one or more multiple teeth. Okay, yes, you can chew with it, but it doesn't function like natural teeth. There are some pros and cons to that option. The third one is a dental bridge. Okay, in this case, you have to have a tooth behind and in front of the tooth that is supposed to be removed. Basically, this bridge will hook onto these two teeth, and you'll have what is called a pontic, which is connected to those. Okay, this functions kind of like a natural tooth, and then you can bite and chew with it, but you have to learn how to floss and clean underneath it. Okay, and the last option you typically will have is a dental implant. This is a single tooth replacement. An implant could be used for multiple things, but this in particular case is basically a man-made tooth that we put in its place, and that is about as close as you're going to get to natural teeth. Okay, you can brush that and floss that. So these are my top 4 questions that I recommend before considering getting a root canal. Okay, I know you're in pain, but take the time to really consider these questions first before you move on to the next step. If you guys have any questions, please leave comments below. I'd love to answer them for you. And thank you for taking the time to watch this video. Until next time, we'll catch you later.